Welcome everyone, and thank you so much for joining us. Here, let me turn my camera on so you can see me. Um, Thank you so much for joining us for the very first session in the 2026 Kidney Patient Advisory Council Summer Webinar Series. I am Kelly Brooks. I'm coordinator for the Forum of ESRD Networks, and today is all about treatment options. And we're so pleased to have a number of patients with us to talk about their experiences with various modalities. We also have Dr. Daniel Landry with us to talk about hemodiafiltration, or HDF, which is a newer modality that's now available in some places in the US, and Susan Dillon, who will talk about the transplant process. But first, I just have a couple of housekeeping items to go over with you. If you can stay muted, that will help to minimize background noise and interruptions. You will have an opportunity to submit questions using the chat feature, and we will get to those questions toward the end of the presentations. You can submit the questions at any time during the presentation. We're just going to wait until we get to the end to answer them. And today's presentation is being recorded, and we will post it to the forum website for future reference. If you have to leave early, or you just want to watch it again or share with colleagues, you're welcome to do that. A survey link to an evaluation form will be included in the chat. I actually already included it by accident. I was trying to post a link to our webinar series, but I posted the survey, so both things are there, but I'll post it again toward the end so you have access to that. I'm also going to include a link in our follow-up email that you will receive after the webinar, and just know that we really appreciate your feedback as we plan future webinars. Lastly, we have two more webinars in this series. I did post a link in the chat for registering for those. One is on nutrition for CKD, and the other one is on vocational rehabilitation. So be sure to register for these. You can scan this QR code or visit our website at the link posted, or use the link in the chat. And today we do have Dawn Edwards kicking off our webinar. Dawn has utilized various treatment modalities over the years. Welcome, Dawn. We're so happy to have you with us.
Thank you so much, and thank you everyone for joining us on our summer series.
Yes. I have several questions that I'm going to pose to the patients throughout the webinar. So I'll start with the first question. They're the same questions for all of the patients. Dawn, can you tell us, why did you choose your modality? And please tell us what that is.
Okay, well, currently I'm on home hemodialysis, and that's where I have a dialysis machine that is made specifically for home use in my home, and I do my hemodialysis treatments myself using a catheter. So the reason that I chose that was because I did PD first, and I really loved the freedom and the independence that I had from being at home, doing my treatments on my own time. When I got ready to, I could work during the day and do my treatments in the evening. But as time progressed during my kidney journey, I was not able to do PD anymore. So after my first transplant rejected and I had to go back to dialysis, I wanted to stay at home. And so I chose home hemodialysis because I wanted to continue that freedom that I had. And I wanted to get more frequent dialysis, which is another great part of home hemodialysis. You do dialysis treatments more frequently, and you have much better outcomes. You feel better. You have less dietary and fluid restrictions, and it just makes a big difference in your overall quality of life. So as my kidney journey changed and as I grew, my treatment options changed as well. So as I said, I did PD prior to that, and the reason that I chose that at the time, because I had a little one at home, and I again wanted to do my treatments at home, and I wanted to be able to play with, my daughter and let her have play dates and company over. And PD at that time was a great choice for me. It was blood free, needle free. I was able to, um, do things in the household without having to leave for treatment. And it served me very well for 10 years.
Wow. Yeah, that's a long time. You've kind of already answered this question, but maybe you want to expand on it. My next question is, how does your modality best suit your lifestyle?
Absolutely. Both modalities, PD as well as HHD, they both suited my lifestyle in the way that I needed to at that particular time. When I was on PD, it suited my lifestyle because I had the little one at home and I wanted to be able to move around while I was doing treatment. So I was able to connect to the machine and I didn't have to go to sleep. I could walk around and I could run behind my little one as she was, growing up in the house. And I needed to be able to do my treatments at night so that the daytimes was mine. So when it was school time for her, I could take her to school and I could pick her up and I could go on mommy trips with some of my girlfriends sometimes. And I was able to even go on school trips with my daughter as she was growing up. So PD really suited my lifestyle
Mhm.
during that time. And I was a young adult. I was in my 20s. So I really appreciated not having to needle myself or not having blood around my little one and not feeling those ups and downs that you feel sometimes on in-center hemodialysis or not having to go back and forth to the dialysis center. It just really worked out well for me um,
Mhm.
with PD and with HHD. This is phenomenal because again, I have all those benefits of being at home. I have the freedom, I have that control, and I have really great outcomes as a result of doing my dialysis treatments more often. And I love being able to have a pizza and a beer once in a while.
Right? That's right. How do you feel physically?
Um, I feel great. Now I'm not going to sell anybody unicorns and
Right.
rainbows thing. I mean, I'm a dialysis patient. Sometimes I don't have a good day. It's part of the disease, but for the most part, I can pretty much judge how I'm going to feel from day to day. I stay pretty even, um, and I feel strong and I feel healthy. And that's one of the reasons that I chose home dialysis because you're doing those treatments more often. 3 times a week dialysis is just what it is. It's 3 times a week, and that's all you get. But when you're doing home therapy, you get more frequent dialysis, which is more like a little bit closer to normal kidney function. And I shouldn't even say normal kidney function, but it's a lot better because you're getting more treatment and more hours of getting your blood and toxins cleaned.
So, how often do you do treatment?
So I specifically do treatment literally every other day, and
Okay.
I do about 4.5 to 5 hours every other day. So that works out pretty well for me. I do my treatments I'm while I'm in bed, and I disconnect and I go to sleep and I get up and I go to work in the morning. So that for right now, that's working out really well for me.
Right. What would you say to someone who wants to learn more about home hemo or PD?
Anybody that wants to learn more about home hemo or PD, they should really extend themselves and get the information that you need. Talk to your nurse in your dialysis unit. talk to your social worker. If you're not on dialysis yet, you can find out more about home dialysis therapies by looking on Home Dialysis Central. There's a great website for home therapies there. You can try your National Kidney Foundation. Any of the kidney advocacy groups can give you more information, but don't just wonder about it. Do something about it. Find out about it. Find out more about it. Talk to someone who's done it and ask questions
Right.
because it's another option. And always, if you don't like it, you can always go back. So I don't
That's
want
right.
anybody to ever think that they're stuck.
That's right. That's right. Yeah, there are lots of options. This is just two of them. So yeah, I think that's great advice to ask questions. If you want to advocate for yourself, you got to speak up, right? So
That's right.
that's great. Well, thank you, Dawn. I appreciate it, and I apologize, everybody. We have a number of patients to get to, so I thank you, Dawn, for your time. And now we're going to move on to our next patient, who's going to talk about another modality. We have Stephanie Dixon. Stephanie is an in-center dialysis patient, and she is going to talk a little bit about that experience. Are you with us, Stephanie?
Yes, I am.
Hi,
But
how are you?
hi, great, thank you. And you?
Good. So same questions for you. Why did you choose your modality?
Okay, before I discuss the why of my decision, I'd like to share how I came to that decision.
Sure, go for
Okay,
it.
I was diagnosed in the emergency room with ESRD at a local hospital, and I was what would be called commonly crashing into
Mhm.
dialysis. Now, I had never heard of dialysis before, and I wasn't of a mind to ask, what is it? So I concentrated on the words of my ER doctor. He said, if you don't get it, you're going to die. My mind concentrated on the word die. I assumed that I was dying wrongfully. Okay. When I got to the clinic, my doctor told me that I was a good candidate for peritoneal dialysis. But before that, she suggested that I explore the in center clinic, ask questions before making my decision. So when I entered the clinic, I heard all these bells and whistles and blood and people running around like crazy,
Mhm.
and it really frightened me. So
Sure.
immediately I thought, I'm not doing that. I don't know what peritoneal is, but I'm not doing that. So I went on peritoneal for 4 years. I loved it. It's very clean. It's very safe as long as you follow the infection control protocol, etc. But four
Right.
years later, I got a hernia. So I had to go in center. I was told for 1 year until my hernia, cleared up.
Mhm.
So after a year in center, I decided to stay in center because of my lifestyle. Number one, I'm retired and I offered the freedom that it offered me. Also, I don't have all the boxes and supplies in my house. When someone would come to visit me in my apartment and they saw all these boxes, the question I would be asked is, are you moving? No, I'm not moving. These are medical supplies. So then I started just having people over at the end of the month when the supplies were very
Mhm.
low. Okay. So once I started in center, I was very happy with it. I live in a one-bedroom apartment. My apartment does not look like a clinic, and I'm not inundated with all those boxes and medical supplies and things I previously stated.
Right.
And the responsibility of someone else taking charge of my treatment was appealing to me.
Mhm.
Okay. I also have traveled out of state several times over the past 20 years with no problems. And I would suggest to anyone who wishes to travel, which I also did travel on peritoneal, I would advise you to check with your social worker, or check the CMS website, Dialysis Facility Compare, so that you can ensure that you're going to a reputable clinic. Clinics are rated, there's a 5-star rating method, and the hours of the clinic, the days of the clinic, what types of treatments they offer, etc., are all on this website. So let's see. And I also would like to point out that in the past 20 years, I've had 0 infections and 1 minor hospitalization 10 years ago.
Hmm.
Okay.
Yes.
Um, let's see. It's also important to, if you're an in-center patient, to learn the do's and don'ts of what the staff is responsible for. For me, most importantly, is infection control.
Hmm.
Haven't had one, don't want one, but it's important to make sure that medical supplies are not shared between patients from one patient to another. And as I said, that's very important to me
Right. Right. As it should be. And I know that you advocate for that all the time,
all the
which
time.
is so important. So yeah. How do you
And
feel
I have my
physically?
signs. I have my signs that I would put up in the clinic.
Right.
Please wash your hands. Thank you for washing your hands, etc. And the staff is well aware that it's not that I'm germ phobic. I don't want to get an infection. I don't want to be hospitalized.
Right. And that's smart. Yeah. I'm sure that they understand.
Yes, they do.
Um, yeah. And so how do you feel physically as an in-center patient?
I feel fine. I do 4 hours, which I know I'd like to say that healthy kidneys work 24 hours a day, 7 days a week, and that is 168 hours. By comparison, I only receive 12 hours of dialysis cleaning. So my
Hmm.
life sustaining treatment is approximately 7% of what a healthy kidney person receives. However, I make sure that I am a compliant patient. I follow my dietary and fluid restrictions for the most part. Do I cheat? Of course I do. I'm human. And if I feel like eating something, I don't eat it that I'm not supposed to eat on a regular basis. I will have it, but not on a regular basis. So my numbers are excellent. As I said, I haven't been hospitalized in 10 years, so I'm good.
Yeah. Yeah, you're doing a great job. And so my last question for you is what would you say to someone who wants to learn more about in-center dialysis?
I would say talk to people who have been trained and make sure, because anyone can tell you their personal experience, which is fine, but some people don't really know and or understand how the kidneys work or how dialysis works in helping you stay healthy. As I said, I
Right.
like to have a gentle treatment. So generally, I don't exceed my fluid intake to make sure that when I go to the clinic, I'm taking off a minimal amount of fluid from my body and removing toxins from my body, which helps me ensure that I am awake, alert, able to get around and do what I need to do.
Right. Well, thank you for that. I love hearing these different perspectives on various dialysis modalities. In-center is so different from home, is so different from PD, and it's great that you all have found what works for you, and that's what this webinar is all about. So, thank you, Stephanie. Next, we're going to move on to Dr. Daniel Landry. Dr. Landry is going to tell us a little bit about hemodiafiltration, a newer modality in the US. So, Dr. Landry, I'm going to turn it over to you. Are you here with us? Let me see. Oh, Dr. Landry is not on the call. Okay, well, that's all right. We're just going to move ahead. We have Ronnie Gibson. Ronnie, I'm going to let you talk a little bit about hemodiafiltration, and then maybe we can come back to Dr. Landry when he joins us. Hold on one sec. Let me pull up my slides again so you all can see. All right. Okay, here we go. So this is a little bit about Ronnie. Ronnie, are you with us?
I'm here. I was talking, but I was on mute.
That happens to all of us on Zoom, and no matter how long we've been using it, everybody talks while muted. Okay, so welcome. We're so glad to have you here, and we're going to talk a little bit about HDF. Tell us why you chose your modality.
Well, when I chose to go on HDL, I've been in dialysis in clinic for 5.5 years. I make 6 years on the 20th of August, and I started HDF in March. And what made me want to go, because at first when they asked me, I kind of denied it. I told them that I didn't want to try it. And she came back and she told me about it's supposed to minimize cramps. So when she said
Mhm.
that, I said, come back and tell me a little bit more. Let me hear when she said that those cramps, because if anybody that's on dialysis, those cramps is something that you don't want to experience. They hurt real bad. And when she said that about cramps, that got my attention. So when after that, she explained to me about the cramps. So I was like, well, yeah, let's try it. You know what I'm saying? And I was asked, you know what I'm saying, about the first year I was in dialysis, I was told about home dialysis, but I couldn't take the home dialysis for the simple fact that I didn't have anybody at home to support me and help me in it. I had small children. My wife is a administrator at a school. She had to work. It just wasn't enough support for me to do it, so I couldn't take the opportunity to do it at home. So I've been in clinic, like I said, the last 5.5 years, and I guess that a lot of people on here then dealt with dialysis and being on the machine. So when I first started the machine, we kind of all know how it goes. Like when I first started, I kind of had an upper hand because I had a cousin, an auntie, and an uncle that was already on dialysis. So I had kind of got a little education on it before I got started with it, knowing some things to do, some things not to do. And when you first start something, you just ain't always in compliance. About the first 3 to 4 months, like I kind of struggled with it, but it wasn't about just doing what they was telling me to do. It was about the mental issues and stuff that I was dealing with. Just this becoming a new thing in my life and being a man, a father, and a husband. It affected me in so many ways to like I was just down and really not focused on doing anything right in the beginning. So just to fast forward to the HDL, when I got the opportunity to get on it, I remember the first treatment that I had on HDL. I had a whole bunch of nurses and a couple of doctors from other states that was around when I got put on it for the simple fact I was the first person in the state of Louisiana to experience the machine. So a lot of people was there watching me as I took the first treatment. And I really didn't realize what it did until I got off the machine and getting ready to walk to the scale. When I get to the scale, I tell a nurse, I say, I feel like I didn't even have treatment today. And she was like, what you say? I said, I feel like I ain't had treatment. I'm talking about this is the first treatment. Then she run in the back and she go get all the other doctors and nurses and they all run back out there. And they was like, you feel good? I'm like, yeah. They like, well, we really wasn't expecting that on the first treatment because they were saying before you start feeling better, it's gonna be out to 40 to 60, treatments. And after the first one, I felt like I said, I didn't feel like I kind of felt like I want to say normal, but we'll never say all the way 100% normal. But I felt good. I left out. I got because I drive myself back and forth. I get back in my vehicle. I called my wife on the phone, and this is the first thing she said to me when I called her. She was like, "Did you have dialysis today?" I was like, "Why would you ask me that? I'm leaving dialysis now." She used to can tell by the way my voice how weak it was when I get off the regular hemodialysis, and she was like, my voice sounded like strong in the regular way, like she thought. I guess she thought I had played hooky or something. But no, like that was the first treatment. And ever since, like I said, I've been doing it since March. Ever since I have been on HDL, I have not had a crimp. And that's been since March. And here it is, July. Haven't experienced the crimp. And I had the example of seeing the difference on last week. I didn't know it. Something had happened to the HDF machine. And basically I had regular, they ended up giving me regular hemodialysis. So as I got off the machine, I'm walking up to the front, going back to the scale, and like I kind of felt like my back of my hamstring kind of tightening up. I'm like, man, why? I'm feeling like I'm about to get a cramp, and I haven't felt like this yet. Then the tech had came and told me that I didn't have the HDF that day. I had regular
Right.
dialysis. So I'm like, man, I felt the difference between the HDF and the hemodialysis, the hemoglobin dialysis, like
Right.
that's the treatment. So as I went back, it was about 2 days later, and I still felt that effect of low on energy and didn't want to be more active like I was being on the HDF. And it was like 2 days of this. So when I go back to dialysis, I told him, I'm like, look, if something happened to this machine, just please move me to another machine because they said it was gonna take so much time. That's why they didn't switch me that day to get the machine back up and running. That's the reason why they didn't switch it that day. But I told him, I wish you would have told me that because I probably would have told you I'd have waited the time.
So, how long, comparatively between regular in-center hemodialysis and HDF, can you tell us a little bit about what the differences are that you experience as a patient?
The difference is number one for me, no cramps. Number two is the energy, the high energy I have, active that more how active that I'm able to be after treatment. Like I said, I have young kids, I have a wife, I'm a baseball coach at a high school, I'm a pastor, associate pastor at a church. Like I got a lot that I have going on. I got a lot that I do on a daily basis. And I'm more active in all these things. And like a lot of times when I used to come home from the regular dialysis, like I had to like just sit down at least 3, 4, 5, 6 hours before I can get my mental right to be able to focus to do what I needed to do. And on HDL, I haven't had that since I've been on it. I'm just able to come home and do what I need to do, go where I need to go, do my hobbies. Like I said, I fish a lot and that's one thing. At least 3 times a week, I'm on the water. I'm fishing. You know
That's nice.
that changed when I was on regular dialysis. I'd probably fish probably 2, 3 times a month. You know, where I'm doing that 2, 3 times a week now.
That's fantastic. Yeah. So I think it's safe to say that you feel better physically.
Basically, yes. But
Yeah.
more energy, more improved quality of life.
Absolutely. Yeah. I hear that. Well, I know Dr. Landry, he had a hospital emergency, so he's going to be on in a little bit to talk about the specifics of HDF and what it is exactly. So this is a good introduction for that. And lastly, Ronnie, what would you say to someone who wants to learn more about HDF?
Do your research, find out about it. I wish we had more people that's able to advocate about it and let people know about their experiences. But just do the research, check it out. And I also want to add this. I was on a call earlier, and I never heard this question like in this way before. It was this guy kind of like comparing like home dialysis and this new HDL machine. And like I never experienced home dialysis, so I can't speak on that behalf. But he was saying how home dialysis make you feel better, and you get more treatments at home doing home dialysis. I'm an in clinic patient. I do 3 days, 4 hours of treatment. And and it's just my opinion, my assumption, my thought. So when he said that, it kind of registered in my mind. I'm like, so what if a person was able to do this HDF those many days? You see what I'm
Hmm.
saying? And I tell you three
Hmm.
things, and I'm giving you the true feeling on how it affects me. And it's just 3 days a week. And it was just something I just want to throw out there, like it's something to think about. Like if you had HDF at home, and you're able to do as much more treatments as you do at home, like would it make you feel normal?
Right, right, exactly. Um, yeah, great points. And I think, the key to all of this is people need to do their research, ask questions about the different modalities. And as Stephanie Dixon is fond of saying, the best modality for you is the one that you're going to do. So you got to find what works for you and do it. So thank you so much, Ronnie. I'm going to move along here to Sue Dillon. She is a transplant program manager for UW Health Transplant Center, and I believe I'm going to share your slides if I'm not mistaken. So let me pull those up really quickly.
Please, thank you. I am so happy to be
Sure,
here, and Zoom is never always that good to me, so I appreciate it.
not a
And
problem.
and very motivated by all your stories. I'm on the other end of the spectrum here in transplant, so it's very motivating to hear how people are living great lives on hemodialysis. So um,
Absolutely.
yeah.
Okay, I'll turn it over to
So
you.
kidney transplant. So that's something nobody ever wants to hear, that you may need a kidney transplant, but we try to make things at UW Health as easy as possible. We have a great transplant center. You could probably go to the next slide there, Kelly, if you're putting them. There you go. We have a great transplant center at the University of Wisconsin. We're highly rated, and I'll tell you how you can look at different transplant centers in a little bit, depending on where you live. But the first process is, or step in the process is, if you are notified by your nephrologist, dialysis center, your PCP, whomever, that you may be going down this road to needing a kidney transplant, the first thing you really want to think about is referring yourself or having that physician or dialysis center referring you to a transplant center. And it really is typically done. I mean, a lot of people that live in the Chicago area, for instance, will seek care in their Chicago area, but they will also come into Wisconsin and seek care there. And you can list and look at several centers at the same time. But I would say start working with one so you kind of understand what's all involved in going through the process of a kidney transplant. Once you've done the research and self-referred or had someone refer, you're called by our staff, and our staff will bring you in for a transplant evaluation. And what's involved in that is that you meet with a physician, be it a nephrologist, a kidney doctor, maybe a surgeon, and then you meet with a coordinator, a nutritionist, and a social worker. It's about a 4-hour, half-day process where we want to, as a multidisciplinary team, want to look at you and see, is this the right option for you? So we typically ask you to have labs drawn. We may do a chest x-ray in the beginning of your evaluation. And we really kind of go through the process. What does it mean to be a transplant patient? What does it mean to get on a kidney waiting list? What does it mean to be a patient after transplant? What's all involved? So we go through a very good, thorough presentation during that evaluation process. And then after that evaluation process, you are linked with a coordinator. That kidney coordinator then takes you to something we called a multidisciplinary review or selection committee after we have all of your testing done. And so the key is getting testing done. So sometimes it's a CAT scan, sometimes it's a chest CT, sometimes we have to have you have a mammogram, all the things. Once we are satisfied that we have most of those things, we'll bring you to that selection committee and present you. This is Mary, she's 50, she's been on hemodialysis for X amount of years, and this is her story. And then we go from top to bottom on everything that's going on with you. If people have their testing done and completed, if we've got all the pieces of that puzzle, then we're able to pretty quickly from that selection meeting get you onto a kidney wait list. Sometimes we have to come back to people and say, oh, now they want you to see a lung doctor. They want you to see a heart doctor. So it's not always cut and dried, easy peasy. It really depends on your personal story. And then once we do and have the ability to get you on our kidney wait list, then you're on that wait list from anywhere to 2 to maybe 5 years or more, depending on your blood type. Our center is known for transplanting quickly. So I would say, on an average, an O blood type is 5 years. It might be sooner. On an average of A or an AB blood type is going to be 2 years. So it really is blood type dependent. But there's a way of kind of getting around that as well. And then once you've been on that wait list, you've been evaluated, we're essentially thinking you're ready to go. And we send lab work out periodically to make sure that you're not sensitized, meaning that you're not going to reject that kidney. If somebody has a baby, if somebody has blood, things like that can kind of change your body a little bit. Once you're convinced that that's all okay and you're firmly on the wait list, then the next step is obviously transplant. If you've been on that wait list for like 2 years, and some people will be then, or a year, depending, we'll bring you in for a reevaluation because we want to make sure that we're up to snuff on everything that's going on with you. So the main process here is getting into that transplant center, looking to see who you really want to list with. A lot of times it's insurance dependent. Some insurances will say you can go to Wisconsin. I'm using Wisconsin because that's what I know. Others will say you have to stay in the state of Illinois. So sometimes it can be insurance dependent, but you want to pick that center. There is a website, and I can put it in the chat, of the Scientific Registry of Transplant Recipients. It's a registry and a website really dedicated to people like yourself that can go in and say, what's going on at UW Health? How quickly are they transplanting patients? What more can I find out about the transplant process versus maybe, again, I'm using Illinois, University of Chicago. What are they doing? So you can get on that website. It's incredibly helpful to kind of see what's going on with different centers. And I will put that in the chat. If you want to go to the next slide.
Sure.
So, some people kind of hit on not loving dialysis, and sometimes you cut it short or you don't go. Once I totally get it. I don't, but I've never been on dialysis, but that's going to be an important consideration when you're being looked at for a kidney transplant. The psychosocial aspect of your journey is very important. Do you have support? Do you have someone there that can really take care of you after that initial transplant? The transplant itself is about a 4-hour operation, and it dictates that you stay in the hospital for maybe 4 days. But then sometimes the kidney is sleepy and it needs some time to wake up. We call that delayed graft function. So we may ask you to stay within the Madison area if you came to us a little bit longer. So that time in the hospital is typically short, but sometimes we need you to stay a little bit longer. So you really want to have that person that's dedicated, that can be with you, that can stay with you and help you, take you to lab, etc. Is you're limited to driving initially with a transplant. And then making sure that getting to that transplant center is doable. So if you live in Upper Michigan, is it doable to really come down to Wisconsin 12 times a year after your transplant for all those lab visits, potential kidney biopsies, etc.? And people will take that into consideration also when they really pick their transplant center. And then different transplant centers differ on their criteria, the expertise of their surgeons, their nephrologists, and their services. I will say, I can really proudly say that our transplant center is bar none. We do incredible work. Our coordinators are superb. We follow patients for life. I think most of our patients feel that our coordinators are part of their family. They really help guide you through the process, both pre and post kidney. And it's a big family at UW. And our surgeons, we've been doing this for a long time. We have a solution that actually is used during the process called the UW solution. So we are really kind of pioneers in kidney transplant. So I can say very proudly we're a good program to be at. And then, oh, I'm sorry, somebody asking?
No, I just said yay. That's great.
Oh, yay. And then the last
Great
slide.
to hear.
Yeah, the last slide is living donation. So really nowadays, and I'm not going to bore you and go into really nitty-gritty details, but it used to be that if you lived in Madison, let's say that most of the donors to receive those kidney transplants came from Madison or the surrounding area. Nowadays, these kidneys are coming in from all over the country. They did something in 21 to make there be a fair allocation of organs across the country. So nowadays, the kidneys are coming in maybe after being out of the body for 15 hours. They go on a pump, but it's not like getting that that kidney that's maybe been out of the body for a couple hours. So we really feel that live kidney donation is the way to go to get a really good, healthy kidney. It's awkward to go to your neighbors, your friends, your family and say, will you donate a kidney? But you'd be surprised people come out of the woodwork that you never thought would really want to help you out and do. We have now a navigator that works with our patients to help them have those difficult conversations. Open up something called a microsite where you go on a website and you kind of advertise that you need a kidney. So we kind of help you have that discussion with people. And truly, it's like, oh, this neighbor 2 doors down, I never knew the guy, barely said hi to him, and he wants to donate his kidney. So it's really kind of shocking to a lot of people that there's really some really good humans out there. They don't have to be your blood type, which is a misnomer. Some people think, well, what if he isn't my blood type? You can register into a kidney, the National Kidney, the NKR, National Kidney Registry, and maybe your kidney will go to somebody else, but then your friends will get a kidney from that registry to kind of replace your kidney if you're not the same blood type. So you can donate even if your blood types are different. The living donor kidney is going to last longer. It's going to work quicker typically, and it does reduce wait time. So if you've got a living donor, you're going to jump up in the line to get that kidney transplant. So it's really something that I think a lot of centers are looking at right now, really encouraging that people look for living donors and are really kind of putting a lot of resources into living donation.
Right.
It's fascinating to hear the stories of both the donors and the recipients and the bond that they form also after that situation happens. So
Yes.
it's a scary process. It's a lot. It's a lot of information that you receive during your evaluation process. It's a lot to process and think about. And there's some work on the back end. There's taking a lot of medications. There's coming in frequently to see your doctor, potentially, getting a biopsy, etc. But at the end of the day, people feel it's worth it. They can live very healthy lives and be off dialysis. So
Yes.
it's an option, I guess.
It is. It is
Yeah.
one of several options, and it's a great option. So thank you for running us through that process. This is your last slide, I believe, right?
Yes. Yeah.
Okay. Yeah, I was going to say we have a patient on our kidney patient advisory council who actually took out a billboard looking for a living donor, and it turns out his cousin saw it and ended up donating a kidney to him. But you got to do what you got to do. You got to pull out all the stops.
You
So
do. It seems
yeah,
like someone just had their 7-year kidney anniversary. Congratulations. Yeah, you do have to pull up all the stops. And especially, I know it's different in all different parts of the country. In the Midwest, we're Midwest nice. We can't even ask for a loaf of bread from people. But so we can't even, how would we go to my neighbor or my friend? But it's people are amazing creatures. So something to think
yes.
about.
Absolutely. Thank you so much, Sue. This is great information. I'm going to move on. I think we're going to talk to Mary Malaco first about she's a transplant recipient, and then Dr. Landry, we're going to come back to you. I see you're on now. Thank you so much to talk a little bit about HDF, and then we'll if you guys want to stay a little bit later, we can have some questions as well. So let me share my screen one more time so you can see a little bit about Mary. And like I said, Mary is a transplant recipient. Hello, Mary. How are you?
I am well, thank you.
Good, 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 good. So can you tell us, I don't want to say, I don't want to ask you how you chose your modality, because it seems a little bit different with your journey in transplant, but if you just want to share a little bit about that, that would be wonderful.
Absolutely. I think, yeah, my journey has been as everybody's is a little different than each other. But I ended up with kidney disease when I was 9 years old. And so things kind of just were evolving. I'm old enough that I've seen a lot of those changes. At the time, they weren't dialyzing children and they were not transplanting children. So they actually told my parents I probably had about 6 months. So, it was what was going to happen. And, transplant was still on the newer side. And I was a teenager when I actually needed a transplant or dialysis. And so I started with, as you'll see, that I started with in-center hemodialysis. And it was a mess for me. The bottom line is for me, it became very challenging. Access was very challenging. Sometimes I would get poked with needles, 6 times and sent home because they couldn't get it in and they'd try again the next day. It was always difficult every time I did. So I had a fistula, then they went to a graft. Eventually, I ended up with a catheter. Again, it was difficult. I was probably in the hospital on an average, the amount of time that I was on dialysis, I would say I averaged probably once to twice a month, either in the ER or in the hospital, because labs were off, potassium was high, all sorts of issues that were causing problems. The other thing is that dialysis was also affecting my heart. So my choice was kind of my only choice, is really to look at transplant. And so, when we talk about, having options and choices, it was difficult for me to do dialysis. And as you can see, I've had 4 transplants, all successful. First one was 4 years, second one was 4 years, third one was 11, and I'm currently on 27. I was on dialysis before my first and before my second. One of the things we did not talk about is preemptive transplant. And I was very fortunate that because was not doing well on dialysis, so by the time I was needing my third transplant, we were doing everything possible that we could so that I would not go back on dialysis the third time or the fourth time. And so I was preemptive. We were watching things very closely. So I think that's one of the big areas, I think, for me is, really looking at being involved with your care. And as time went on, I grew up with this. So, that was part of initiating things early.
Gotcha. Yeah. Um, and can you talk a little bit about what your lifestyle is like as a transplant patient, maybe how you maintain your transplant and take care of yourself?
You faded out a second there.
Sorry about that. Zoom
That's
is
okay.
not my friend today. Can you talk a little bit about how having a transplant has impacted your lifestyle and what you do to take care of your transplant and how you take care of yourself?
Yes. Well, I think one of the things that was encouraging when as I mentioned, my first transplant, I was a teenager, and my social worker walked into the hospital room after my transplant and said, "Now that you have a working kidney, what are you going to do with your life?" Honestly, didn't think I'd live long enough. So that was like kind of eye-opening, but it also was really empowering for me, and it really changed my life by what she said. It made me realize that I was alive and that I had a future because with dialysis, I wasn't doing well. Matter of fact, I coded while I was on dialysis as well. So for me, I was able to finish high school. I went on to college. I had a career. I actually married my person. I think that was big. I think instead of spending my days in the hospital or on dialysis, I'm able to travel. Oftentimes you'll find me hiking or out with my husband and my dogs hiking. I'm pretty persistent about doing Pilates to stay in shape. And also, I think just that second chance of having a healthy life. So for me,
Right.
transplant has really been, none of these treatments are cure-alls. But for me, the best option has been a transplant.
And how do you feel these days physically?
It's funny, I think Dawn kind of said it really well. You have your good days and your bad days. I've been on this journey for, transplant for 45 years. And before that, dialysis and, living with a chronic rare kidney disease. And so I think for me, um, again, you have your good days and your bad days. But overall, I feel wonderful. I can do all the things I want to do. People ask me, do you have any restrictions? All the things that I used to have because I reacted so difficult. Like I don't even have high blood pressure anymore.
Mhm.
I had high blood pressure from the time I was 9 years old. And until my last transplant, I had high blood pressure and all sorts of other issues. So now, I mean, really, the kidney's working great. I would say my biggest issues now are just dealing with some of the side effects of the medication,
Mhm.
which I'm willing to take because it's giving me my life.
Right, right. Yeah, it's a trade-off for sure. And like I say to someone who wants to learn more about transplant.
I think I kind of alluded to this early. I think you need to advocate for yourself. If you have kidney disease, I think the more you can educate yourself and the more you can get like evaluated, whether if you're looking at transplant, there's nobody that says you have to be on dialysis before you have a transplant. Um, so I would say I'd encourage people to advocate for themselves, to get evaluated if they want a transplant. You know, my first one was a living donor. It was from my brother. And so, you know, if we had probably realized that I wasn't going to get sick, like just boom, you know, that I was kind of, I always say, limping along, I might have been able to have preemptive for my brother, but it wasn't until I was on dialysis that he kind of said, I want to do this, because I wasn't doing well on dialysis. So I think, you know, I would say, you know, talk to your healthcare team. Find out what your options are before you have to, you know, as many people end up, you know, on dialysis emergently, through the emergency room and things like that. And I think if you have an opportunity to kind of make those choices when you're not in the crisis of what you want, and if you are looking at transplant again, living donations and a great opportunity. The weight is not the same, as Susan mentioned, and you can have a really good match oftentimes.
Right, right. Great. Thank you so much, Mary. Um, I want to give a little bit of time and I want to give a shout out to Dr. Sam, who is answering some of the questions in the chat for us. We have a lot of really great questions, and I want to get to some of them if you guys can hang with us. I do want to have Dr. Landry come on and join us and talk a little bit about HDF because I there are a lot of questions in the chat about HDF, and I think people are really interested in that and what it is. So I really want to give him some time to talk a little bit about that. Dr. Landry, are you ready to roll?
Absolutely. Thanks everybody for having me tonight. And I apologize for getting here a little late. But Kelly, would you like me to share my slides?
Sure. If you want to do that,
Or
that'd be great.
okay, okay, great.
If
Uh,
that's easy for you to do. If not, I've got them.
I think I'm doing it okay. Let's
Okay,
see. Here she is. How's that look to everybody? Okay.
good.
Um, Terrific. Okay. Well, again, thank you everybody for having me here tonight. It's always a pleasure, and getting a chance to listen to other people speaking as well. I think that obviously the big takeaway, as we always like to encourage, is to make sure that everyone has all the options, that people can really make their own individualized choices that works best for them. And something that's coming out right now in parts of the country and evolving here in the United States is something called hemodiafiltration. It's only being offered in some dialysis clinics and not all. Um, and it's being kind of brought out slowly. So don't expect it to be out everywhere all at once. But I want to share some information about it tonight because I think from the perspective of if we talk about transplant and how the different some of the new approaches to give people more options, likewise we want to make sure that for people who choose or are on hemodialysis, they have some different options as well. And hemodiafiltration offers one of those things. So I just wanted to let everyone know that I am a medical director for Fresenius Medical Care, in a in-center as well as a home dialysis clinic, in addition to enjoying my time as the president of the forum. So, but here I just wanted to show kind of a very interesting picture in terms of hemodiafiltration, how many of us here in the United States have said, well, what is this? I've never heard of it before. And yet, if you actually take a look back over the last decade or more, it's actually something that's been provided in different parts of the world, and at an increasing rate, as you can see. What I want to share with you all tonight is just why that's happening and now why is it showing up now in the United States? And why do we need change? I mean, why do we need to bring along this different approach, which still includes dialysis? So I want to be clear, but we'll talk more about that. But if we take a look, we still see that the 5-year survival rate for people living on dialysis remains unfortunately far lower than it should be. And despite different changes, different efforts to dialysis over the years, we've still been kind of stuck for a long time in terms of really improving the quality of life and longevity of people who are on hemodialysis. So, to that end, what's been recognized for a long time is that hemodialysis, the standard way of people receiving blood-based hemodialysis or treatments, is really good at removing certain waste products, those very small ones that accumulate in our body. But when it comes to removing larger waste products, hemodialysis isn't really great at that. And it's been known for a long time. Um, and so actually it was dating back now over 40, 45 years when this whole idea of hemodiafiltration was brought up. And what it is a combination of hemodialysis as well as hemofiltration, which I'll talk a little bit more about in a moment. But what it offers is actually the removal of some larger waste products that build up in our system. So all of us make waste products, right? We rely on our kidneys to remove a lot of those waste products, and they come in different shapes and sizes. Um, and with hemodiafiltration, it was postulated even way back that, boy, if we could remove some larger substances, maybe we could help people feel better. Maybe we could help them live longer. And it's been described, the use, as I mentioned, in Europe and Japan and all parts of the world now for the better part of the last 15 years. But to date, there really hadn't been what the United States had considered a high enough quality study to say, you know what, let's go ahead and bring it here to the United States and let's give it a try. So without boring people too much, but I do find that when we talk a little bit about science, understand a little bit why things happen and why we do what we do, it helps a little bit. So in a typical dialysis treatment, just to briefly let people know, your blood is entering through the dialyzer on the top part of this dialyzer, top part of the screen where it says QB, and then it's returning back to you on the bottom part of the screen. And simultaneously, dialysate, a clean, sterile fluid, is running in the opposite direction through this blue line. And then as it actually removes waste product, it comes out on the orange line, if you will. Okay. So that's what hemodialysis typically does. And yet with hemodiafiltration, what's happening is that we're performing hemodialysis simultaneously, but we're actually removing more plasma water, more fluid from the individual, which actually drags out or takes out some larger or middle-sized substances. In order to do that, we have to also give our patients back a very super clean, sterile solution that we call replacement fluid. But at the end of the day, most people, if anyone here tonight performs hemodialysis, you actually have fluid removed every day, every time you do a treatment. That's removing the volume, the fluid that you've gained since your last treatment. Here, we actually remove that same amount, but actually, even to a higher degree, we remove much larger amounts. And as I mentioned, we have to replace that with something called replacement fluid. This is just a little brief schematic that shows us what was up until about 2-3 years ago, the amount of data that existed, studies that were done mostly in Europe, but also, as you can see, in a few other parts of the world, that had shown some evidence of benefit when using hemodiafiltration compared to hemodialysis. But with all that said, from the United States standards, the quality of these studies still raised some questions and made people say, I'm not sure we've actually seen enough information yet to really tell us that there's a true benefit of one modality over another. And that led to this study that was put together many years ago now and then reported in the New England Journal of Medicine, a very well-respected medical journal here in the United States, reported back in 2023. It was called the CONVINCE trial, okay? And the CONVINCE trial was a study that was done in Europe in 8 different countries, 61 different centers or dialysis clinics, and patients were, we say, randomized, or they were either placed into a group receiving standard hemodialysis, oftentimes referred to as high flux hemodialysis. That's what you all receive now, if anyone who's here on dialysis. and then compared to an equal amount of people receiving hemodiafiltration. And I'm happy to talk about details about the study, but some important and critical takeaways is that it was done in a very practical way. It was done in a well thought out way. And what they showed at the end of the study, first and foremost, is that, you know what, we can do this. We can provide hemodiafiltration safely to people. And over the course of the better part of about 2 years, people did very well. And in fact, in this study, they actually reported a 23% reduction in all-cause mortality, death, in the people receiving hemodiafiltration compared to hemodialysis. Okay. Now, this was done during the COVID pandemic. If we kind of think about the dates that I'm showing you, and so many people can raise questions about that in terms of how would that compare today post-pandemic. People can also raise the question to say, well, is the European population as much of a melting pot of different people as we see here in the United States? And I think the answer to that is clearly no. So there's always challenges and things to talk about with different studies. But at the end of the day, I think at least the study that was done well and very well thought out showed a mortality benefit. And it was based upon this study. It was the reason why in the United States, the FDA said, you know what? We're going to improve hemodiafiltration if dialysis providers want to bring that aboard. And one of the large dialysis organizations is doing that as we speak. So that is really kind of the major takeaway. Is there anything else out there? I think if we talk about one modality that may have benefits to people, and one major study showed that, are there other things out there that could be a benefit? And what I'll tell you right now is that there's actively being studied a different type of dialyzer that also can remove larger substances like the hemodiafiltration. To date, they don't have the same type of data showing benefits to patients, but it's being actively studied now here in the United States. So, as we've learned, as I said earlier, about the excitement of coming around transplant and about also treating people with chronic kidney disease to prevent kidney failure. Likewise, there's also now I think, some very interesting therapies and things coming out for people who are living on hemodialysis, and I think some great opportunities. So my conclusions here are that the final word regarding the outcomes with hemodiafiltration is not all completely settled science. People will always be raising questions about different studies, but one very large, important study showed a mortality benefit when comparing to hemodialysis. And it can be done safely. And it appears to be able to be done in an environmentally friendly way in terms of water savings, hopefully, is what the hope is. And it's just begun to be rolled out here in the United States. I'm going to be working in some clinics that will be experiencing this, so I'm really excited about it. But there's still ongoing research and some potential alternatives that may be out there currently being studied. These, and in one particular, as I showed you, referred to as the medium cutoff dialyzers, or MCO. So that's what I wanted to share with the group. And again, I want to thank you all very much for your time tonight. I know Dr. Rahman's been busy taking care of some questions and all, but certainly I'm happy to answer any questions as well.
Thank you so much, Dr. Landry. That was great. Does somebody have a question? Or was that Dawn? I don't know who that was. Was that Dawn?
I was getting ready to ask a question. You must be reading my mind, but I had
Go right ahead.
I had a kind of two-part question. I wanted to know, Dr. Rahman kind of answered it. Is everyone a candidate for HDF? And is there a contraindication?
Yeah, great question. And I apologize if Dr. Rahman may have addressed this to some degree, but right now, in terms of the units where this is being rolled out, there really is no specific contraindication. There was a question about people who were below 40 kilograms weight, but I think, but at the end of the day, I think all people are still being considered. Patients 18 years of older, I think, would probably be the one kind of restriction being provided for the time being, just because that's where how the study was done. But beyond that, it's really being encouraged, everyone's being encouraged in the units where this is being offered to say, come on and give it a try. And, so I think it's an exciting time for that.
Really exciting. And what about any like changes in the labs? Do you see better labs? Like a home dialysis patient has generally, better labs and better clearances. Do they have that with HDF?
Yes, if you take a look at particularly this convince trial, there was a little higher clearance or cleaning for people who were receiving hemodiafiltration. And while, the studies over the years, I'm sure as many of you know, has shown that there's a minimum standard that we all try to meet, below which there's an increased risk for death. But higher than that has never been proven to be of added benefit to people. But nevertheless, in the hemodiafiltration arm, in those people receiving the HDF, we did see that they were receiving a bit higher clearance done.
That's great. Thank you
Yeah.
so much, Dr. Landry.
Thanks,
You're,
Dr. Landry.
oh, my pleasure.
We do have a question for Ronnie about mental health. Ronnie, do you feel like your mental outlook has improved since starting HDF?
Oh, most definitely. Yes, indeed. Yeah, that's what I was speaking on earlier. Like, for as my mental, it done got more balanced and more stable now. I'm able to focus on like just dealing with my kids. That like it's a big difference. And I wanted to say something about that those labs. My labs has changed tremendous for us. My phosphorus, my clearance was running between 1.4 and 1.5. Now I'm sitting on like 1.7 to 1.9. And I wish I was just asking my wife. I wanted to actually show y'all my lab paperwork, but I can't find that damn sheet nowhere. But I could have showed y'all my paperwork to prove what it's doing.
Wow.
That's amazing. That's really great news. Um, I am putting now in I think I answered all the questions. Please let me know if I missed any. Oh, here we go. Here's one. Where did you find out where HDF is being offered? So I think Raman might have answered this. It's at some of the Fresenius clinics. Is that correct? Dr. Landry, you could speak to that.
Yes, it is. Fresenius made the decision over a year ago or more that they wanted to roll out hemodiafiltration. Because it's new machines, as I think I saw in the chat here as well, it meant that they had to bring in new machines for every single clinic, of course. So for those reasons, they've been, starting it in certain units and trying to get kind of just roll it out, as we said. Which forgive me if I'm not speaking or I don't know exactly the time frame, but I believe their goal is to have it offered in all their dialysis clinics over the next year and a half or so, or maybe even a little longer. But they're moving through. But as of right now, that's my understanding. Those are the places where it's being offered.
Okay, good to know. Good to know.
Yeah.
Um, well, I thank everyone for sticking with us tonight. I know we ran a little long, but I think the information was well worth the time that we spent. I did put a link in the chat to a survey if you wouldn't mind giving us your feedback. And that's it for us from the forum tonight. I want to thank you all again for joining and have a great evening.
Thanks, everyone.